You got me?
Not yet.
Not yet? Check, check. 1, 2, 3. 1, 2, 3. Hello, CBC. Hello, CBC. Check, check, check.
No, no sound.
No sound. Maybe it's at your end. I don't know. You want to give Leonard a shout?
Yeah, just hold on. Is the podium? Is there sound coming out of the podium?
This is the podium. Yeah, check, check,
I
check.
can hear it now.
Check 1, 2. 1, 2, 3. Okay, good stuff. PEI green. All right, sure. Bye.
Good afternoon. Across Canada, there have been more than 800 cases of COVID-19 and also increasing number of deaths that we've seen reported nationally. Here on PEI, we still have 2 cases of COVID-19. Both cases are at home and doing well. After the announcement yesterday of our second case, we understand that Islanders may have had concerns and questions about the returning travel from out of country for the case. So I'd like to give you details on that flight. The flight was Air Canada Flight 756, which left Toronto at 9:20 a.m. and landed in Charlottetown at 12:28 on March the 11th. The gentleman who is the case was not experiencing any symptoms on the flight, and the risk of transmission is low. Of course, everyone who was on that flight returning from out of country should be self-isolating for 14 days, and any other passengers on the flight who traveled just within Canada are asked to closely monitor their symptoms. Any of those details will be made available on our website today. In terms of a testing update, there have been about 240 tests done as of this morning, and 167 of those have come back negative, and we have 71 still pending. I'd like to get into some of the updates and messages that we think are important for Islanders. I'd like to encourage Islanders who are not in self-isolation to consider blood donation. Our national supply of blood products is very important, especially in a time where current events may impact our inventory in the country, and giving blood can save lives. Our new self-assessment tool is available on the website. It has started last evening, and by later today, it will also be available in French. And it can be completed by yourself, or it can be also completed by someone else on your behalf. And I know information has been already available at the airport here in Charlottetown, and that will continue. But in order to assist, to make sure the returning travelers understand the importance of self-isolation, part of my team, our environmental health officers, will be at the airport as well with information about self-isolation and the importance of it, and meeting travelers upon their return. I ask the public not to attempt to stockpile medications, as it can lead to a shortage of medications for those who may need them. Please speak with your pharmacist about accessing a reasonable supply of your medication. And if you have symptoms, please do not go into your pharmacy. We need to ensure pharmacy staff are kept safe and healthy. And please call the pharmacy before you go in if you're not sure. I want to thank, and this will not be the first time I thank them, but I want to thank all our essential service employees in the different areas of essential services who are supporting Islanders during this very challenging time. They are taking appropriate steps to ensure your safety, and we must respect their efforts and really abide by social distancing measures. This will protect us all. We've updated our list of essential and non-essential businesses on our website, but we're still updating it as we get questions from sectors. And we have had a number of questions from construction, and there are currently a number of builds in progress, and that leaving those structures in the current state they're in may put them at risk of damage. Therefore, if a company decides to continue to operate, we'd ask them to practice the good hand hygiene, social distancing, but we should reconsider any new builds to a later date. But we still need construction to do repairs if something happens to a roof or something happens to your home. So certainly trying to get a sense of what is essential and what can be delayed, and what can be done safely given what we know about this virus. We've also had questions about cell phone and computer repair services and office supply stores. And of course, wherever possible, these locations could operate by calls and emails for deliveries or set up appointments if necessary. And again, if people have further questions, this is new for all of us, and we're trying to make it clear for everyone. And it's important to have children to go outside and be able to go outside and play and be healthy, but they need to do so safely. It's important that children also practice social distancing. It's not just for adults. Children should be participating in activities that respect that social distancing and that recommendation of staying 2 meters apart. And this includes sleepovers. Sleepovers should not happen. And I'm sure my children are watching and may not be thrilled with that. But if you play ball hockey out in the street, that's fine. But sports where you're playing basketball and sharing and being really close, those would not be recommended. Children should be supervised, not just allowed to go out in groups, in subdivisions without supervision, so that they can try to maintain that social distancing. Children can get sick, and they can transmit the virus to others in the community. So it is not just adults who need to practice social distancing. And as we move into the weekend, I recognize that our children, but also our adolescents and young adults, are wanting to get together, and they're missing each other. And I cannot stress enough the importance of finding new ways to continue to engage with each other that does not involve that close in-person contact. You know, I say that, and somehow it's hard to say and give that message, knowing that we want to hold our children and play together, but this is not the time for that to happen in the same way. As Dr. Tam, Canada's Chief Public Health Officer, said yesterday, social distancing isn't just something we're recommending loosely. It really is required at this time. We continue to work with the Chief Public Health Officers across the country, and just as I know Premier King and the premiers are doing, to try to make sure as much as possible we have a unified and coordinated approach to COVID-19. But we're also respecting that some jurisdictions are at different points in this pandemic, and additional precautions may be put in place depending on what they're experiencing. This is our chance to get this right, and Islanders really need to follow this guidance. I've said it before, and I'll say it again. We need to do this now to protect ourselves, our families, and our communities. Social distancing and self-isolation will be what helps protect us in the weeks ahead. This is not a dress rehearsal. And I'll turn it over to Marian.
Good afternoon. I'd like to start by first thanking our healthcare workers who've been engaged from the beginning in our planning and preparing and now providing essential services during this pandemic. You've rallied and staff are functioning with patient and resident and client safety as their top priority. I'm happy to say that we're very close to our goal of reducing our bed usage to 75% across all our hospitals, and we should meet that target by later today. This is a monumental effort and has required a lot of thought, communication, with planning and many people across the health services and with our patients and families. We thank the public for your understanding as we continue with our temporary reduction in services to be prepared to respond to the situation as it unfolds. With regard to testing, we continue to screen patients at 2 sites, one in Charlottetown and one in Summerside, 7 days a week. We have the staff and supplies necessary to meet the testing needs, and individuals continue to be screened and sent to us and will be given an appointment through the 811 service. We're also asking for help from retirees, including all healthcare workers and volunteers. This is both clinical and non-clinical staff and support that we're looking for. We'll need all kinds of workers, service workers, housekeeping, other staff to help support our infection prevention and control protocols. The number to call if you're interested as a retiree to help support our efforts with Health PEI is 902-368-4927. All healthcare workers that are coming back to work with us will be assessed and registered or licensed through their respective professional colleges and associations, and retired healthcare workers will be assigned to duties that fall within their qualifications and skills and knowledge level. To date, we have 27 registered nurses who are prepared and ready to provide service when called upon. 13 of those 27 continue to work with us as casual registered nurses at Health PEI. We'll be reaching out to our nursing students as well and as other students to assist us in their response as we go forward. There are many roles to play in our response to the COVID-19, especially as we prepare for a possible surge in patients needing care. I want to thank the public for complying with the recommendations of our Chief Public Health Office and the officials across the country, as well as our healthcare providers and staff who have stepped up to the challenge in our care settings to continue to provide these essential services to Islanders during this emergency situation.
Bon après-midi. Je vais juste mentionner quelque chose en français. On a 2 cas ici encore confirmés de Covid-19 à l'île du Prince-Édouard à l'heure actuelle. Et à la fin de la journée hier, 240 tests avaient été réalisés à l'île du Prince-Édouard. Nous attendons les résultats de 71 tests, mais les autres 67 tests négatifs ont été confirmés. Je vous encourage, les insulaires, ceux qui ne s'isolent pas d'eux-mêmes, de considérer le don de sang. Il est très important de suivre la demande de notre approvisionnement national en produits sanguins, surtout à une époque où les événements actuels peuvent avoir une incidence sur l'inventaire. Donner du sang peut sauver des vies. Notre nouvel outil d'auto-évaluation est maintenant disponible pour les insulaires pour aider à déterminer s'ils doivent être testés pour COVID-19. Et la version française de l'outil sera disponible plus tard dans la journée. Des informations ont déjà été mises à disposition à l'aéroport, mais aujourd'hui, nous aurons des agents de santé environnementale à l'aéroport de Charlottetown qui distribueront des fiches d'auto-isolement en anglais et en français. Il est aussi important que les enfants pratiquent également la distance sociale. Les enfants ne devraient pas participer à des activités qui ne respectent pas la recommandation de distanciation sociale de rester à 2 mètres l'un de l'autre. Cela inclut les sleepover pyjamas. Les enfants doivent sortir, jouer et être en bonne santé, mais ils doivent le faire en toute sécurité. Les enfants doivent être surveillés, pas en groupe, dans les subdivisions sans surveillance, mais les enfants peuvent tomber malades. Ils peuvent transmettre le virus à d'autres membres de la communauté. Ce ne sont pas seulement les adultes qui doivent pratiquer la distanciation sociale. Et alors que nous entrons dans le week-end, je reconnais que nos enfants, les petits, les adolescents et même jeunes adultes peuvent devenir un peu agités, ils veulent se voir, mais je ne saurais trop... Il faut insister sur l'importance de trouver de nouvelles façons de continuer à dialoguer entre elles, ce qui n'implique pas de contact étroit en personne. Je vais prendre d'autres questions en français, mais qu'est-ce qu'on fait maintenant est très important. Et puis, c'est le temps de le faire. Le auto-isolement, d'avoir la distance appropriée entre les gens, c'est les choses qu'on peut faire pour diminuer l'impact dans les semaines qui suivent. Merci.
En français, donc j'en profite. Docteur Morrison, question pour vous. Est-ce que vous pouvez redonner les détails précisément du vol ou des vols qui a été emprunté par le deuxième porteur du virus, s'il vous plaît?
Le vol était du cas d'hier, était Air Canada, vol numéro 756. Et de Toronto à 9h20 le matin et puis arrivé ici à midi 28 le 11 mars. Et tous les gens sur ce vol qui ont voyagé hors du pays doivent être chez eux pendant 14 jours en isolement. Et puis les autres sur le vol qui n'ont pas voyagé hors du pays doivent faire attention aux symptômes de fièvre, tousser. Et si quelque chose ici ont des symptômes, d'appeler 811.
La personne qui a pris cet avion de Toronto, avant ça, avait pris un vol Londres-Toronto?
Et puis, cet vol tous les gens sur un vol qui arrive hors du pays doivent être les gens doivent être isolés et puis c'est les détails de les deux vols vont être mis sur on a indiqué aux agences de santé publique du Canada et puis ils vont mettre les vols sur un website aussi.
Dr. Morrison, Wayne Thibodeau here at CBC. I'm wondering if we might be able to ask you a bit about social distancing. I think if I read your quote correctly, you said we want to hold our children and play together, but this may not be time to do it in the same way. So are you now recommending that partners and children, that we social distance from our families as well?
And I think it's maybe because I'm missing my children so much. I haven't seen them very much lately. So no, I mean, when you're in a family, you have little children, and they need your partners need you as well. But if I'm thinking children, all our children in the community, and a lot of our children are raised by many other people in the community. But it's that we don't want children really playing closely together outside, because it's hard to know if one of their parents had traveled and if they are ill, and you don't want to spread that infection. And so I think it's really, and I'm glad you asked that, Wayne, just to clarify it, but it's about trying to maintain social distance and stay at home. We're asking Islanders to stay at home unless you need to go out. And if you're in self-isolation, there's good information about what self-isolation means. If you need to go out of the house and you're not on self-isolation, do so with maintaining that social distance and do all these things that we can do to protect ourselves and our families and the community.
Has there been any consideration, Dr. Morrison, to closing the bridge in the airport?
So, I mean, I think the bridge and the airport are important for our goods and supplies to get across. And any decision to, for especially to close the bridge would be, what we're talking about there is interprovincial border closures. And that would be something that would be discussed with all the provinces. And it would be important to do that together. And if we need to get some of our islanders home. And if we close our airport today, they would be having to come into Moncton and Halifax and then get across the bridge. So it's certainly discussions if we need to do something, but that would be a further discussion certainly with airport authorities, Transportation Canada, and with the other provinces.
And can you clarify, I know you're doing this in French, just that Air Canada flight, can we just make sure we have the numbers and dates and all that correctly? And can you also clarify that those people on that flight, whether they were just flying from Toronto, meaning domestically, should they be self-isolating?
So it was Air Canada flight 756, leaving Toronto at 9:20 a.m. and landing in Charlottetown at 12:28 p.m. on March 11th. And those travelers who were on the plane, who were on a connecting flight from returning outside the country, they should be self-isolating for 14 days. Others who may have just been in Toronto for business do not need to self-isolate, but they need to monitor closely for symptoms over the next 14 days.
Du sang, pouvez-vous nous expliquer s'il y a une forte baisse des stocks de sang au Canada en ce moment à cause du Covid-19? Et si les insulaires souhaitent donner leur sang, comment ils peuvent le faire en toute sécurité et en gardant les distances de sécurité?
Oui, et puis la discussion avec les centres où vous pouvez donner le sang prend toutes les mesures pour s'assurer de protéger les gens qui veulent donner du sang. Puis ils vont organiser quand vous venez, ils vont utiliser des équipements pour protéger les gens qui travaillent là-bas et aussi les autres gens au milieu. Alors, et puis, ils ont des discussions partout au Canada à cause de ça.
Est-ce qu'il y a une pénurie particulière à l'île du Prince-Édouard, un shortage de sang spécifique à l'île?
Un shortage ici à l'île du Prince-Édouard? Est-ce que ça?
Oui.
Non, et puis ils ont eu le montant qu'ils ont prévu la semaine passée. Alors, à ce moment, à mon avis, tout ce que je connais maintenant est qu'il y en a assez.
Docteur Morrison, vous parliez de la fin de semaine, des enfants qui jouent dehors, prendre des précautions. Est-ce que vous êtes inquiète justement de cette première véritable fin de semaine avec cette Covid-19 à l'île du Prince-Édouard? Est-ce que vous êtes inquiète de voir les insulaires sortir beaucoup plus et ne pas respecter toutes les consignes que vous avez données au cours de la semaine?
Je pense à la majorité du cas, les insulaires vont respecter ce qu'on vient de dire. Et puis, c'est pour cette raison que j'insiste vraiment qu'il fait attention aux avis qu'on fait parce que c'est tellement important. Je ne suis pas inquiète parce que j'ai beaucoup de respect pour les insulaires de suivre les avis. Mais je mentionne parce que des fois, les adolescents et les jeunes adultes veulent se participer, mais je pense qu'ils peuvent participer et de faire les FaceTime, d'autres sortes d'activités pour virtually d'être ensemble.
Question pour moi, Dr Morrison. Juste, est-ce que vous pouvez revenir sur la question de Wayne concernant l'aéroport et le pont? Est-ce que vous avez déjà discuté d'une possibilité de fermer ces deux points d'accès à l'île du Prince-Édouard?
C'est toujours une discussion, mais il faut avoir la nourriture, on a besoin des choses qui viennent de Nouveau-Brunswick et partout au pays. Et puis, il y a une décision de fermer le pont et une décision à faire avec les autres provinces parce qu'on parle de fermer les entre provinces. Et puis, ça, c'est une décision de faire entre provinces et on fait ça ensemble. Mais c'est toujours une possibilité, mais à ce moment, on aussi imagine que les insulaires qui essaient de revenir dehors du pays vont arriver plus pas les 2-3 jours qui viennent. Et après ça, j'imagine qu'il n'y aurait pas autant de gens qui viennent dehors du pays.
Dr. Morrison, it's Wayne Thibodeau here at CBC. I just want to ask you how you're holding up in all this, because it must be difficult to, not only the hours you're keeping, but the fact that you have to pick up the phone and tell someone they have this COVID-19. How are you doing?
Well, Wayne, thank you. It's hard. And it will continue to be hard. And we talk about the unintended impacts that this has on our society. And I'm most concerned about the people who are sick, who may get sick. I'm worried about how we reduce that number of people who will be ill and have bad outcomes. There's absolutely impact that we feel in our work colleagues, who I have an incredible team with me, and they are working so hard with me, and yes, it absolutely can take an impact on me. And even when we were talking about the children here earlier, I found that hard to read because I miss mine.
And I just know that we've seen such an incredible response on social media about your leadership on this file. I've seen everything from calls for the order of PEI to your face being superimposed on Superwoman. What are your thoughts about the impact Islanders have in response to the leadership you've been providing so far?
I thank Islanders for their support. I'm not on social media, so I am usually told about these things, and I appreciate it. I'm thankful, and I hope we all together get through these weeks ahead. And thank you.
So, Dr. Morrison, Jim Day from The Guardian. I share that sentiment. I was going to ask that question myself, but ultimately, I'm not going to ask the Indian question to have you forecast when this is all going to come to a close, but ultimately, what needs to happen on PEI and globally for measures to be eased on the island?
I'm sorry, I have difficulty hearing the question.
Okay. What ultimately has to happen on PEI and globally for the measures to be eased on the island?
For the measures to be seized, you mean to if someone's not complying with our measures?
No. To ease them or reduce them and
It's the question of when do we stop the measures that we have in place?
Exactly.
So it's a good question. So we'll be working certainly with our epidemiologist and the public health team, and we've said right along the sooner we can do some of these measures and minimize the impact, the sooner that we can start removing these measures. And I think we all look forward to that day. I do have a correction because in my notes, apparently I think a number got left out. And I'll correct this in English and French. Air Canada flight 756 and there's a 4 on the end, 7564, which left Toronto and then returning on March 11, and that's Air Canada vol 7564 et c'était le 11 mars.
Dr. Morrison, Sean McDougall from
Podessa.
I just had a couple questions about ventilators. Yesterday, Dr. Theresa Tam said that the federal government hasn't received requests from any provincial health authority for ventilators. As I understood from the other day, that the province did put in a request with the federal government. I'm just wondering if you could clarify that for us.
We were asked what our request was for ventilators, so we'll be speaking with Dr. Tam this afternoon, and maybe we can clarify that what that discrepancy is, because we were asked what our supply needs were, and that was submitted.
Okay.
I'm not sure exactly the details, but Marian, I don't know if you want to add.
We did submit the request through that national group that was looking at ordering them, and we had requested 15 through that national request. So that was what we had put forward. But in addition to that, we have been working with our vendor locally to see what we can procure in the meantime as well.
Okay, thank you very much.